TVC News, Enugu.
Let's talk health now. The World Health Organization has raised alarm over an increasing rate of tuberculosis infection in Borno State. The body described it as a likely time bomb for the nation if preventive measures are not in place to curb the spread. The organization's head of mission spoke during the Northeast Nigeria 13th W.H.O. end-term joint operations review in Yola. TVC News Owolabi Adenusi filed in this report.
An estimated 9.9 million people were affected with TB in 2020, with Nigeria having the highest number of TB cases in Africa and accounting for 4.6% of the global TB burden. This is according to the WHO Global TB Report 2021. Tuberculosis remains a major public health problem globally and is one of the leading causes of death worldwide. The Institute of Human Virology Nigeria has identified Lagos State as the epicenter of tuberculosis in the country, with more than 300,000 cases left undiagnosed nationwide every year. It appears that Borno State will soon be on top of the infection map. At the inauguration of the 3-day workshop organized by WHO for critical stakeholders in the zone, the organization's head of mission disclosed that the rate of tuberculosis infection in Borno is worrisome and warned that tuberculosis in Borno State could become epidemic. But he assured of WHO's readiness to work with Borno government to address the problem.
WHO is not a donor. It's a member state organization, and our role is really to make sure that the capacities the states need are there, either through training or through backstopping support. But we can also work to mobilize, to help them, the state mobilize the resources they need.
Governor Babagana Zulum of Borno talked about the state of healthcare in Borno and how insurgency crippled more than 50% of health institutions, killing medical personnel and abducting many more. The governor, who was represented by the Borno Commissioner for Health, Dr. Baba Malam Gana, said the attack on healthcare infrastructure accounts for the high rate of tuberculosis.
One of the consequences of this is the issue of tuberculosis, which needs a lot of staff to work on it, including machines like the molecular machines to work on it. Currently, we're using in some places, even for immunizations, we have to use the military to help us, take us to such places.
Governor of Adamawa State, Ahmadu Fintiri, was represented by the Commissioner for Health, Felix Tangwami. He thanked the organization for its contribution to the state in many ways.
One of the challenges now the health sector is having in Nigeria is the issue of human resource. People are trained, they go away, they cross over, and you are still left with just a few to handle health issues in this country.
It is expected that at the end of the Northeast Nigeria 13th WHO meeting, the organization will come out with a blueprint that will help the governors of the region to tackle health issues